Thanks so much. I think I'm going to wrap up our panel. I'm Courtney Lyles. I'm based at UCSF, and I'm based at our public hospital at San Francisco General Hospital. Next slide. And one more. So hopefully I can actually tie up some threads that I've heard throughout today's symposium. The first is, of course, we're talking about the wonderful success of CA Notify, and then the lack of equity in terms of even from fundamental things like who owns a phone and who owns devices and has data on their phone to use it in the way. And so this is a slide that I think represents some of that data that we've talked about right pre-pandemic about who's using the internet nationwide. And this is shown by income, but the patterns persist by age, by educational attainment, and by community status. Next slide. And I think the other piece that I really wanted to hammer in is really thinking about the third pillar here and how people use their phones, which really has to do with their skills and their strategies about how they want to use their phone in everyday life. So there's not great national data on digital literacy that I'm aware of, but within San Francisco, where I'm based, we're lucky enough to have a digital equity initiative that sits within our mayor's office of housing and community development. And they were able to do a survey pre-pandemic of both internet users as well as internet users who reported having basic skills such as doing an online search, finding a website, sending an email, and filling out online forms. And the reason I want to sort of level set or show these data is that even in a really tech-connected city like San Francisco, which has a lot of people using the internet and having skills, as soon as we break down populations within the survey of patients who are more likely, or rather citizens who are more likely to be patients at San Francisco General, where I work, you can see here that both internet use as well as basic digital literacy skills go down with many types of subgroups in our city. And this is unique and local for San Francisco, but I think is repeated across communities nationwide. So when we think about new innovations and amazing strategies, we also really need to think about people who are using their phones in different ways, and how do we engage them and move forward. Next slide. And then, of course, those are some barriers for us to think about, but I won't belabor this slide, but just to let you know, just because we have differences in how people have smartphones and how people use their phones, it does not equal lack of interest in using new innovations or new tools. And so when you think about really fundamental things like that's shown in the box here, searching for online health information, the same proportions of people are really interested in doing these kinds of things. And we find that over and over again in many research studies that myself and my colleagues have done. And so we need to really think about this solution of high interest and potentially disparities in use, and thinking through other structural, interpersonal, and individual level factors that go into how we'll get to the next phase, I would say, of where we want to go with exposure notification in the next phase. Next slide. So these are themes that I think we've heard today a couple of times, and it's something that we've been thinking about for a while. And so I just wanted to put this up as one idea of trying to pull together some of the themes that we've heard. So obviously the use of new technologies and frameworks have to be built on a real foundation of trust and motivation to be able to use the technology. They have to be supported by the right devices, connectivity, and skills to be able to use what we're offering. And then sort of at the top of the pyramid, they really have to be usable for all populations, frankly, that we're talking about in this session. So it has to be really created with community and co-design that we've heard a lot about in the last amazing talk, with principles that make it really accessible. And then for health focused strategies like exposure notification, I would say health literacy, readability, language access, and then the digital accessibility are really sort of at the top of this pillar. Next slide. So we really early on, I would actually say it's right at the end of that pilot stage that you guys showed for the when CA Notify was rolled out, we tried to take down as many of the COVID app and exposure notification systems that were available in the App Store and Google Play, and just sort of, I would call these practical or foundational elements. They are not getting at those motivation and trust and community that we're talking about here, but I would say these are sort of at the top of the pyramid, things that could increase the accessibility of the tools for more users. So how many of them were written at a less than 5th grade reading level? How many of them were available in multiple languages? Had audiovisual components like videos and audio files to enhance comprehension, had inclusive imagery, and then had minimum scrolling, actually no scrolling and minimal text to actually help people navigate through and find the information that they needed. So these, I would say, are really core things for thinking about that we've done with many of our research studies that I think can be applied here. I know these were very early on in sort of the development of the tools, and I've actually heard almost all of these been picked up in the thread today about where it's going next and improvements that have been made in the platform itself. And I think these are things that we need to also think about specific to digital strategies to get us into the 2.0 phase. Next slide. To sort of close it out, I really just wanted to emphasize what we were just talking about in the last two amazing comments by Dr. Gibbons and Dr. Wen, that really from this national digital health equity workshop from the National Academies, that technology is really about people and that community engagement is at the center of what we want to do, right? So if we take these principles and moving forward, I think we can envision a new scenario in which it will be the easy to use or the passive or the not thought about strategies that Dr. Gibbons challenged us with a few minutes ago. And then the next slide is just some resources in case you're interested in other groups working in the digital inclusion, digital equity space for thinking about how to both increase the device ownership and also the skills for people to be able to take up things like we've talked about today. Thanks so much.